afternoon, everyone, and welcome to today's webinar entitled Clear the Air with Smoke-Free Apartments. My name is James Campbell, and I'm the Senior Manager of Industry Relations with NAA. I want to welcome all of our members in attendance. Thank you for joining us. Before we get started, I want to go over a few housekeeping points. First, this presentation is being recorded and will be posted to our website and YouTube channel next week. You may then share this presentation with those colleagues and friends who are unable to attend at present. Second, we have a lot of time at the end of today's presentation for live questions and answers, but you may also type your questions into the Q&A or chat boxes on your screen at any time during our presentation. Next slide, please. Third, a brief disclaimer that the information provided in this presentation does not and is not intended to constitute legal advice. Instead, all information is provided for general informational purposes only. Next slide, please. Now, I'm very pleased to introduce you to today's presenters. Carlene Crawford is Regional Tobacco Control Manager for North Carolina Health Region 4, which I believe covers 11 counties. Anna Stein is an attorney and legal specialist with the North Carolina Department of Health and Human Services / Division of Public Health. And Scott Wilkerson is Chief Investment Officer at Ginkgo Residential. All three presenters have deep experience with this topic from multiple perspectives, so welcome. Now let me turn the presentation over to Scott.
Thank you, James. Welcome everybody to today's webinar. I hope that everyone is doing very well and that you're planning to join us in about 3 weeks in DC at Advocate and then in Atlanta in June for Apartmentalize. Both are great events that I look forward to every year. I've attended both for many years and really enjoy the networking and the sharing of ideas. As Chief Investment Officer for Ginkgo Residential, I'm always looking for a good idea anywhere I can find one. I spend a lot of time watching and listening to others, and not just other apartment owners and managers. The Hotels for Advocate, Apartmentalize, and every other meeting I have attended for a long time are a wonderful place to find good ideas. They provide housing, but the timing of the lease cycle from application to move out is just a little bit compressed compared to what we do. As a result, hotels are often on the cutting edge of what residents want. One of the amenities provided by every hotel I stay in is a smoke-free environment. Hotels didn't used to be smoke-free. First, they tried smoke-free rooms, then smoke-free floors. Eventually, they learned that allowing smoking anywhere inside the building is essentially the same as having a peeing section in the pool. The vast majority of their customers are not happy with pee in the pool or tobacco smoke in the air. So today, we want to talk about making your apartment home smoke-free. We will quickly review the history of smoking in America, talk about the business reasons why smoke-free apartments are a great idea, hear the legal side of the question, and then discuss implementation of smoke-free policies, including specifically how to convert apartments that allow smoking into smoke-free housing. Anyone here watched the series Mad Men? It starts in 1960 when I was 3 and ends in 1970 when I was 13. I grew up in North Carolina, which was often referred to as Tobacco Road, and just like Mad Men, smoking and tobacco were everywhere. A constant barrage of ads appeared on television, radio, in magazines, newspapers, on billboards, and almost everywhere you turned. We had the rugged Marlboro Man all over the place, and slogans like, "Winston tastes good like a cigarette should," "Us Carlton smokers would rather fight than switch," and "I'd walk a mile for a Camel." Tobacco advertising was banned in 1971, but smoking was still allowed everywhere. Cartoon characters like Popeye and the Flintstones smoked. Even Santa Claus was a smoker. As kids, we had candy cigarettes made of sugar with a red tip so we could act like we were smoking. Doctors were featured in tobacco ads for many years, promoting the freshness of Camel cigarettes, the use of filtered cigarettes, and the claim that exactly 20,679 physicians say that Lucky Strike cigarettes are less irritating because they are toasted. Smoking was everywhere, including restaurants, bars, offices, stores, even hospitals allowed smoking. I remember seeing patients smoking in bed when I visited with my parents in hospitals. We had smoking areas at high schools. Even some junior high schools, now called middle schools, had smoking patios where kids with permission were allowed to smoke. The only place smoking was not allowed when I was growing up was in the sanctuary at church. But you had to go through a huge cloud of smoke just outside the door every time you wanted to enter or exit the building. Smoking was even allowed on airplanes. I hated it. No matter where you sat on the plane, you could smell the smoke and you had to breathe it. And you might be surprised to find that smoking on airplanes in the United States, domestic and international, was not fully phased out until the year 2000, only 23 years ago. This graph starts in the 1960s and shows the history of smoking and the change in smoking in the United States. It peaked at around 45% and then gradually started to decline. A similar graph with a few more years is shown here from 1944 to 2018. It just gives you a picture of what has changed over my lifetime. Young people in particular have stopped smoking at even faster rates than adults. This is seniors in high school, and that change has accelerated more recently. Relative to our business and our customers, if you look at this green line, these are this shows the percentage of smokers between 18 and 29, and that's the same group that is most likely to rent a home, apartment home in most cases, and it has declined the fastest. As of 2022, Gallup reported that only 11% of US adults are smokers. That is a dramatic 75% reduction from when I was a child and a massive cultural change. Carlene, can you tell us a little bit about why this happened and why this decline in tobacco smoking continues at an increasing rate?
Sure, Scott, thank you. Next slide. So looking back, things really did begin to change when the first Surgeon General's report on smoking and health came out in 1964, and that actually linked smoking to lung cancer. It was a real eye-opener for many. Next slide. And since that first report, there have actually been 20 Surgeon General reports. This is sort of the go-to science documenting the harms of tobacco use and smoking. Next slide. So in 2014, it was the 50th anniversary. The Surgeon General put out a report that this image came from, and it really illustrates how tobacco use impacts the whole body, every organ. And those conditions that you see in red here, those are newer diseases that were correlated with smoking at that time. On the left side, you see 13 different types of cancer, and then all of those chronic diseases. Next slide. So two of the reports that came out, one in 1986 and one in 2006, really focused on the harms of secondhand smoke. And of course, the 1986 one we don't remember very well, but the 2006 one we certainly do, because it was widely publicized. And in retrospect, we really began to look more at smoking in indoor environments and how to move it outdoors. And we kind of continue to do that today. Next slide. So why? Well, we all know that tobacco smoke is bad for health, and that there is really no safe level of exposure. So think about even a brief exposure for someone who might have a heart issue or, maybe have asthma. It could literally trigger a medical emergency. A lot of chemicals, 7,000 chemicals in secondhand smoke, with many carcinogens. Next slide. And this is another great visual. I really like this because it just kind of shows the health impacts to adults, to children, and even pregnant women of secondhand smoke. Even babies are not immune. It's a known cause of sudden infant death syndrome. Next slide. Scott really likes this visual, and so do I. It's so true. If one tenant smokes, everyone smokes, right, Scott?
That's right. It's kind of like the restaurants years ago. They had the smoking section and what we call the secondhand smoking section.
That's right. It certainly can travel through a building, and there's really not a way to stop it. And so, we know lots of evidence that it can go through your air ducts, cracks and floors and ceilings, even through your plumbing. So the only way really to prevent that is to move it outside. And it can even hurt your pets. And I know we all love our pets.
Carlene, everyone, probably almost everyone on this webinar has been in a smoker's apartment after they've moved out.
Yeah.
And we all recall the smell can be overpowering and it's very difficult to remove. What is the impact of what is left behind when a smoker leaves one of our apartments?
Well, that's what we're going to talk about next, Scott, and that is called third-hand smoke. So we talked about first-hand smoke, we talked about second, but third-hand smoke, and again, all of these folks probably on this webinar have experienced it. It's that toxic residue that sticks to surfaces and stays where it lands. And in indoor environments, it might be on the floor or on the carpet, on the furniture, and sticking in the walls as well. So let's see how harmful that is. Next slide. It stays in the environment a long time after smoking has stopped. I think for a secondhand smoke, it can stay up to 5 hours, but this stays much longer. And what can happen is it can react with indoor oxidants. So think about the bug man coming in to spray, or possibly you've been cleaning. It can re-emit into the air. When it mixes with those things, it can be as harmful as secondhand smoke. And while I'm talking about chemicals, you can see, like secondhand smoke, that it does have a lot of chemicals that can harm your DNA and damage your cells, in addition to other harms that it can cause.
Carly, what about the new stuff, the vaping, the e-cigarettes? What do you have those?
Okay, well, let's see. If you'd move to the next slide while I'm talking about those chemicals, the aerosol in e-cigarettes. Now, you all probably know them as vapes. And, that is an industry term to have a perception that these are water. But it is not harmless water vapor. It has some of the same toxins as secondhand smoke. And the bottom line, Scott, is that the recommendation is it should be treated the same as secondhand smoke to prevent exposure for people. So back to you.
Thanks, Carlene. So as we've looked at the cultural changes, if you go back many, many years ago, there's been a lot that has changed over the years, both as a result of the 1964 Surgeon General's report, the 2006 report on involuntary exposure to secondhand smoke. A lot has changed. This slide gives you a little idea of the growth of cigarette smoking, tobacco smoking in the United States from about 1900 up until well into the 2000s. And the number of people who smoked peaked around 45%, and it's down to about 11% today. And that cultural change has been really dramatic. I mean, we're here in North Carolina, and again, North Carolina was known as Tobacco Road because of our large production of tobacco. It was everywhere growing around the state. When I was a kid, we had large tobacco companies producing cigarettes and other forms of tobacco, and that has really changed. Even North Carolina banned smoking in restaurants and bars and a number of other places in 2010. And along the way, as we talked about, it was eliminated from airplanes, from public schools. I remember when I started in college, smoking was allowed in classrooms. By the time I got to the second half, or really my junior year, that had been banned. In hospitals, it was banned. Many offices, government facilities, parks and recreation locations, some of this by government action, but a huge percentage of it has been by private action, by building owners and others. As I mentioned, in 2010, North Carolina took a stand to eliminate smoking in bars and restaurants. The change was actually requested by a lot of bar and restaurant owners. They didn't want to do it on their own, but as a bulk group, they weren't as afraid of the change. And many found that it actually increased their business instead of decreasing their business. The only
Scott,
really,
can I
yeah.
add, I actually have a restaurant owner in the town that I live in that told me his business increased by 25%.
Yeah, and that's amazing. I know
Yeah.
there are a lot of places I wouldn't go before, and I love live music, and I couldn't go because they were smoky. And once that was eliminated, myself and a lot of my friends started going on a regular basis. The one big exception to all of that was residential multifamily buildings, including apartment buildings. But that is changing rapidly as apartment owners understand the reasons why smoke-free housing is good for their business. So let's talk about it. Why is smoke-free housing good for business? Number one reason, our customers want it. We've done surveys, other people have done surveys over the years, and we have found, originally we found more than 75% of our residents preferred a smoke-free residence, including many of whom were smokers who do not smoke in their own homes. They didn't want to expose their other household members, particularly their children, to it. And over half of our residents told us they would actually pay extra for smoke-free. Those numbers have gone up over the years, and the last time we did a survey, it was well over 90% responded in a favorable way. So smoke-free living is an almost free amenity that you can use to attract and retain residents and reduce complaints about secondhand and third-hand smoke. Again, we've all had one of those apartments where somebody will tell me, well, we can only rent this to a smoker, and there's too many of those sitting off the market. So some quotes that we've heard in addition to the one Carlene mentioned is people saying, someone said we had an entire building lease up in just 30 days because people were calling specifically for smoke-free units. And then landlords generally who have made that change have said they would never go back to allowing smoking in their buildings.
It is an amenity to brag about, Scott.
It really is. Mm-hmm. Hey, Carlene, tell us about this picture. I think one of your associates took this picture.
Hey, yeah, this picture was actually made by one of my colleagues over in the eastern part of North Carolina. And this was damage to an apartment done after 7 years of heavy smoking. And you can see how it's stuck to the walls. And we've actually seen some worse pictures. We didn't have them to show you here, but the fact is that, not allowing smoking in a unit can be a huge cost savings in turnover, which is 2 to 7 times more than turning over a non-smoking unit.
Yeah, looking at some of those numbers, these numbers are low because they're from a survey that was done in 2009, and they've been widely published. And again, they are out of date, but everything is more expensive when you go from a non-smoking apartment to a light smoking and then a heavy smoking apartment. There are some updated surveys that show much higher numbers, even much higher than what is on this graph here or on this chart. I know we once spent over $12,000 to turn an apartment that was heavily damaged by what's now called third-hand smoke throughout the apartment. And that did not include the extra vacancy costs that we incurred while we did that work in order to clean that apartment up and get it back on the market. So smoke-free can save you money on turnover cost. Another place where cost is important is the average cost today of a pack of cigarettes in the United States is about $8 once you add the tax. This particular graph is talking about a pack of Marlboros, but it's just coincidental that the data works out to the same number. So a resident who smokes 1 pack a day, a single resident would spend almost $3,000 in a year, and a resident who smokes up to 3 packs a day is getting close to $9,000 in a year. Here at Ginkgo, we liked the idea of going smoke-free a long time ago, but what pushed us over the edge and into making the change was that smoking residents kept burning down our buildings. Smoking is a leading cause of residential fires, and it is the #1 cause of fire deaths in the United States. So-called improper disposing of smoking materials is the term that is typically used by the fire officials. And here is a study done by the NFPA, National Fire Prevention Association, whatever it stands for exactly, people who write the fire codes in the United States. And as smoking has declined, so have the number of residential fires caused by that improper disposal of smoking materials, and so have the number of deaths, but they're still very significant. The last 5 years of data that NFPA presented still had over 18,000 fires per year and almost 600 deaths per year caused by improper disposal of smoking materials. This is one of the fires that we had back in 2006, 2007 in that area when we started implementing this change. At that time, we had, over several years, we had $4 million plus fires. Yes, we had insurance, but not all residents had insurance. And the fire is devastating to everyone involved, particularly the residents and the on-site staff. And as NFPA had reported, the #1 origin for these fires is the balcony or the porch. And that's where this fire started. Here's another picture of the remnants of that same fire. Again, we had several of them back then. Here's another one, an interior picture. And the problem is this issue just keeps on happening. Here's a fire in October of 2022. You can see that that balcony is totally engulfed. I think in the end, there were 8 apartments destroyed by this fire. And it continues to happen. A property here in Charlotte, I'm glad to say not a Ginkgo property, had this fire just last week where I think it wound up being 40 people were displaced. And again, the fire was caused by discarded smoking materials. It just keeps happening. And so our goal, in part, in addition to those other benefits, was to try to reduce the number of fires being caused by the #1, about this leading cause of residential fires in the United States. So again, just a quick summary: smoke-free is good for business. Our customers want it. They look for it. They appreciate it. It lowers our turnover cost. Smoking is expensive, which reduces the disposable income available to the residents to be able to pay their rent, and it reduces fire risks. It also reduces potential legal liability, and we'll get to that in a minute, because the #1 question that I hear when I talk about smoke-free housing is it legal for a landlord to prohibit smoking? Personally, and I'm not a lawyer, I think maybe the correct answer should be, is it legal for a landlord to permit smoking? But that's not the question I'm asked. But I want to turn this over to Anna Stein to give us a legal perspective. Anna, how do you respond to the questions about smoke-free housing in apartments?
Okay, thanks, Scott. Next slide. So when I think about, when I first started working in this area of smoke-free housing, I feel like a lot of the rental housing providers that came to us would say, but don't my residents have a right to do what they want to do in their home? You know, they're paying the rent. Doesn't that give them the right? So there's this really strong kind of rights space. And I definitely heard residents that we would go to some meetings when people would be taking an apartment community smoke-free, and some of the folks would say, I have a right to do this in my apartment. But that's just not true. So when you think of rights, legal rights, you'd look in 2 places. One would be the Constitution. And then another could be like statutes that a state could pass or the federal government could pass to protect people, certain rights that people have. Well, cases have actually gone up through the courts, and the courts have decided, in every case that has looked at it, that people who smoke are not a protected class and that smoking is not a fundamental right. So those would be the avenues that you would get constitutional protection, and they are not protected there. Next slide. And I also wanted to touch on marijuana smoking and vaping, because I personally spend a lot of time thinking about marijuana and hemp derived products in my work these days, because it almost seems quaint, the days when people smoked cigarettes. That's kind of old news in a lot of cases. And particularly the hemp derived products like Delta 8, very readily available even in states that have not legalized marijuana. Lots of hemp derived THC products on the market that are really commonly being vaped. So I did want to touch on that in this context, and just to say that you have the same carcinogens, irritants, and toxins in the combustion or vaporization of the marijuana and then the hemp derived THC that you're going to have in tobacco. So we have the same problems. And then just as with tobacco, there's going to be no right to smoke or vape, even if it's medical or recreational marijuana. So, there would need to be some specific law on the books to say that, a medical marijuana patient has the right to, smoke or vape medical marijuana anywhere they want to do. Well, typically from the statutes that I've read, they will especially say that the private property owner can prohibit the smoking and vaping of marijuana, because states don't want to have these situations where private property owners are forced to allow people to use, smoke or vape medical marijuana on their property. So there are typically protections for rental housing providers in that state law. Next slide. So as Scott was saying, not only is it legal to ban smoking and vaping on your property, there are possible liability issues for property owners that allow those activities. We have seen examples of, it's just the laundry list that you're used to: violation of implied warranty of habitability, covenant of quiet enjoyment, constructive eviction, negligence. And also, people requesting reasonable accommodations under the Fair Housing Act, who would request that you put them in a smoke-free home. Next slide. So at one point, I did research and looked up a number of secondhand smoke cases in the United States, and actually have a law student at UNC doing an update right now of the list of legal cases. But one that I found pretty striking was out of New York, in New York County, and it was a co-op, and the neighbor's secondhand smoke was seeping into someone's apartment, and they sued the owner for constructive eviction, breach of warranty of habitability, breach of contract, and they actually won $121,000 in attorney's fees. So that's a pretty striking judgment there. I think a lot of these cases never make it to trial, like they're settled, and they probably don't make it to an appellate court where we're going to see the cases like written up. But I do think that nowadays there's such the expectation that people are not going to have to breathe, dangerous smoke in their home, that there's just not the tolerance for it, that it could have been, people might have felt kind of helpless, and they're not feeling that way anymore. They're feeling like they actually have a right to breathe clean air. Next slide. So I did want to touch a little bit on the Fair Housing Act. I am not a Fair Housing Act expert. Many of you probably work with Fair Housing Act lawyers. So I suggest that you talk with them in more depth about this. But I did want to say that it comes up because sometimes housing providers are asked to provide a reasonable accommodation that would allow a disabled person the equal opportunity to enjoy a dwelling. That's what the Fair Housing Act gives them. That's the right that they're given by that statute. So non-smokers with a disability could request a smoke-free apartment as an accommodation. We've definitely seen that. And so then it's just really easier just to have an all-around smoke-free policy rather than try to like move them around so that their neighbor isn't a smoker. I know that some folks have been worried that people who smoke might request an accommodation to be exempt from a smoke-free policy to enable them to smoke in their units. I don't know how much this is actually happening on the ground. I know that's definitely been a concern. Like, what if somebody says they have to smoke? So I think it's important to look into the Fair Housing Act and some aspects of that to try to help answer the questions of how that might actually play out. So first of all, they would have to name their disability. Having an addiction to nicotine is not a disability. So that's not going to cut it. It's also important to note that just because someone is a medical marijuana patient, that does not mean they're disabled. So, there's just a lot of different health conditions that can make someone qualified to be a medical marijuana patient, and that would not necessarily translate to them being considered disabled under the Fair Housing Act. So just wanted to note that. Next slide. Another important thing under the Fair Housing Act is that the person has to show a link between the disability and what they're requesting as an accommodation. And so that's when I start, really questioning what are the links between the disability and their need to like smoke rather than maybe use a nicotine patch that would give them access to the nicotine. And then they wouldn't be smoking or vaping, or they could maybe use a marijuana gummy if they're, a medical marijuana patient. So what would be the link between, for example, like limited mobility? Like I can't get outside to smoke, so I need to be able to smoke inside. Well, what is the link between that limited mobility and your need to smoke? Also, what we used to hear a lot of is things like, well, this person has schizophrenia, they have some mental disorder, and smoking really calms them, makes them feel better. That is really old news. Scientifically, I would say in the last 10 years, there's been a huge push in the mental health treatment world to dispel those kinds of notions that smoking would actually help anyone with a mental health disorder. It's just not true. We have seen higher rates of smoking among people with mental health disorders because culturally there was a big push to get them to smoke. So, and mental hospitals used to actually give people cigarettes. So culturally there was that, but there's not this scientific medical need. So I think we're going to see a lot less of that than maybe there used to be. Another really important thing to understand about the Fair Housing Act is that the requested accommodation, so it has to be reasonable, and if it's a direct threat to the health or safety of other residents or could result in substantial damage to other residents' property, it is not reasonable. And so we see the huge fire risk, the huge risk of secondhand and thirdhand smoke to other residents. So there's a lot of scientific and fire data that would back up the idea that it is not reasonable for somebody to be allowed to smoke or vape in their apartment. And then I also just want to point out, like I said before, with marijuana, there are very easily available non-vaped and non-smoked methods of obtaining the drug. So I do think it would be really challenging for somebody to say, I have to smoke or vape this drug in my apartment, and neighbors be damned. Next slide. So just to touch a little bit on the legal and social landscape of smoke-free policy enforcement. we've seen concern among property managers of, will I be able to enforce the smoke-free policy in court? You know, it's been difficult for me to get evictions for any reason. And are we going to have, is the magistrate going to side with the resident against me? In North Carolina, we have seen property managers win their cases in court. I think that particularly when the property managers are coming from the side of looking at the health of the other residents. And so not just like, we've put in this smoke-free rule arbitrarily and we're going to kick this person out, but to really emphasize that you're doing this for the health of the other residents. I think that makes it a much more sympathetic case. And also every year that goes by, smoke-free policies are becoming much more the norm. And so I think that magistrates would be much more willing to enforce those lease terms. We have also heard about concerns among residents, like are property managers going to use the policy as an excuse just to evict people they don't like, or enforce that fairly? Am I going to be homeless? I think that Scott and Carlene will talk more about this, but it is important to enforce the policies fairly and to make sure that the on-site property managers are enforcing the policy and are communicating it. And, it can definitely be done in a proper way. And, people can work with residents who are having a hard time. I know Carlene will talk more about that. So that, it doesn't have to be a first strike, you're out sort of policy, but eventually the policy does have to be enforced. If somebody just purely refuses to abide by it. Next slide. So just to summarize, yes, it is definitely legal to put in place smoke-free and vape-free policies. You could make the entire property smoke-free if you wanted. You could put in a perimeter, you can't smoke within 25 feet of the building. You could say it's smoke-free except for certain designated areas. So there's a lot of ways that you could implement a smoke-free policy. I would encourage people to make their porches, smoke-free porches and patios, and decks smoke-free, because as Scott said, the number one place that fires start is going to be in those out, privately controlled but outdoor areas. So I'm just going to make a little note about that. And HUD has specifically endorsed smoke-free policies. All public housing became smoke-free in 2018. And smoke-free policies are just like any other lease provision. And so it doesn't have to be super intimidating to try to enforce them. It's just like any other thing that your on-site property managers are having to enforce. So I will turn it over to the experts who have had experience actually implementing these policies and trying to enforce them.
Thanks, Anna. So another quick summary, won't belabor this, but our residents want it. It saves us money. It saves our residents money. Because of the reduction in fire risk, it can lower our insurance costs because fires are charged back through our insurance, and it can reduce our liability for second and third hand smoke. So let's talk a little bit about implementation of smoke-free policies. Over the past 15 years, Ginkgo has converted over 100 properties with around 20,000 units to smoke-free housing. Talk about what we did and how it worked out, and what you might be able to do if you'd like to follow our lead in converting apartments to smoke-free housing. We'll just walk through some of the decision points and the decisions we made. Obviously, you can make your own decisions and decide your own direction. Now, there are a lot of resources. Carlene, I know you have some links later in this presentation to some other resources.
I do, and I will share those. Yeah.
Right. But HUD specifically, you want to talk about the HUD?
Yeah, this HUD book implementing smoke-free housing is excellent, and I will tell you that Scott provided feedback early on to them, and Anna actually was also involved in helping to produce this. So you can get that. The link is in this slide, and I think that the slides will be offered to you at the end of the session.
You can also reach out to us. We'll cover that at the end, but there are other resources as well, other handbooks. If you just Google smoke-free housing, you'll find a lot right there. But let me walk you through what we did and how we got to where we are. The first step in converting an existing property to smoke-free is to educate your staff. Talk about the issue, to talk about the benefits, the reasons why it's important, and what you want to do. And then for years, we used a very simple survey to reach out to residents and ask them for their feedback on the idea of converting to smoke-free housing. I'm not so sure that survey is still needed today, but it is a very good way to introduce your residents to the idea of smoke-free housing and start the process of getting their buy-in to it. Here's an example of a simple survey that we use. I think the HUD survey in their handbook in their toolkit is even simpler than this one. It's very straightforward and very easy to use. And the results have always been the same. Every time we've done one of these surveys, our residents overwhelmingly support smoke-free housing. It's continued to grow as a percentage until it's now gotten over 90% of the respondents have said they are favorable to the policy, okay? The next step is you have to figure out and finalize what your policy is going to be. What are you going to prohibit? Tobacco smoking, vaping, marijuana, other. For example, the Charlotte Housing Authority, when they did their conversion, they're now known as Enlivian, they included anything that puts out smoke, anything that burns. They even included candles. I'm not so sure they're going to have a problem with a one-time birthday cake, but you know, some people like to burn a lot of big candles in their apartment, and that can be a problem as well. But again, you have to decide on what is right for you and what your policy is going to be. Next question on your policy is, where is smoking going to be prohibited? I think at a minimum, obviously, you're talking about the apartment interiors. As Anna said, you really need to include balconies, patios, and porches for many reasons, but the fire risk is a very large one since it is the leading cause of where just improper disposal of smoking materials has been starting fires. Entryways, amenities, we decided that we were going to prohibit all of these. You could not smoke in any of these locations. Then decide.
Scott, can I add that, you know, the recommendation is at least 25 feet from a building. And if there is an air unit, then probably more like 50 feet.
Right, because you don't want that smoke drifting back in and being sucked
Exactly.
back into the building. Depends on your individual circumstances here. But then you have to decide where smoking will be allowed. I'll tell you, the hospitals, certainly the hospitals around here and the schools ban smoking generally from their entire site. A lot of medical facilities have done that, and a lot of building owners have done that. We decided to allow smoking in what we refer to as designated smoking stations, and that was the right policy for us. We decided to do that because if we gave people a place where they could smoke, where it was allowed, then hopefully it would reduce their temptation to violate the policy and smoke in the apartment or on their balcony or their patio.
Scott, go back to that slide and mention your little disposal on the end.
Well, I got that late. I got that later, Carlene.
Okay.
But yeah, that bench has. I'll get a closer up here in a minute.
Okay.
See where you can see what we did here, and then you've got to decide how your policy is going to be implemented and when. We decided that obviously new residents, not the ones showing up to sign a lease today who committed, you know, a month or so ago, but new residents where we could give adequate notice to them that their leases would be effective immediate to prohibit smoking. And then on lease renewal, after we go back to when we give notice of people of renewal, we would give them notice of the new policy. So gradually over a period of 12 to 18 months, all of our apartments and all of our leases would include smoking prohibitions. I have seen some failures in people doing this. I've saw people do an immediate implementation. It did not work. They didn't give people notice. They had too much pushback. They wound up having to back up and start over. I also saw people who say, well, new residents will have to follow the policy, but all of my existing residents, I'm going to grandfather. And that has obvious issues that if you still have people smoking in the building, the policy just isn't being effective. And then additional question is, who does the policy apply to? It needs to apply to everybody. Residents, guests, vendors, and employees. And it's those vendors and employees that can be the toughest apart, but you really cannot have any exceptions or it just becomes too difficult to manage and to enforce. You have to decide what will you do when there are violations. Unfortunately, there will be violations and you've got to decide how you're going to handle that. We decided, and we are still struggling with this and going to consider a major revision in 2023, but our initial decision was we were going to have a verbal notice followed by 2 written notices, and then we were going to issue a fine of $250, which we copied from the hotel and hospitality industry. And that fine would not go to the owner or the manager, it would go to the American Lung Association. We've had a few of those, not a lot, but we've had a few. And only in the worst cases would it lead to lease termination, non-renewal, or eviction. And usually those issues resolve before you get to that because the people who don't want to follow the policy will move out if you give them the opportunity to, which we generally going to at the end of their lease. And then finally, damage charges. How do you treat damage from smoking? You have to decide on that. And we'll get to that in a second as well. So once you have decided on what your policy is going to be, the next step is to let everybody know. You've got to notify your residents with plenty of advance notice. You need brochures, forms, lease forms, signs, advertising, anything and everything to implement and make sure that everybody knows about it. And once you are ready to go, you can start the rollout of it. You can also consider what you can do for your residents who smoke to help them out as you implement the policy. And Carlene, you have some information on ways landlords can do that, right?
I do, sure do. So one of the things that supports these policies is knowing that there is help available. State in our country has a free quit line, and it is available 24/7. It's an evidence-based treatment service with highly trained professional quit coaches that will provide counseling and oftentimes free nicotine replacement therapy patches and gum or lozenges. Many languages are available, and many of them offer not only phone but text and web support as well. And your local public health staff in your own community are often available to support your efforts, as well as potentially providing you resources or signage or helping you handle those compliance issues. So keep those in mind if you decide to move forward, because they're really ready and willing to help you.
Thanks, Carlene. So here's a sample map we used. This one's from a few years ago. We have upgraded them since. But it was put on signs, it was put on handouts, it was put everywhere to let residents know where designated smoking stations were located, where they were allowed to smoke. Here's what Carlene referred to earlier, a little bigger picture of one of our smoking stations. It's basically a simple bench installed away from the building, away from entrances, away from amenities. It is well lit and it is accessible, and it includes a little urn that is an ashtray that looks like it came from the world of George Jetson. And if you know who George Jetson was, then you must be old like me. We also had brochures. We did not want anybody to renew a lease or sign a lease at the property without being well aware of what our policies are and the fact that they have to follow them. It was a simple trifold. It told what the policy was, and it showed people the reasons for the policy. And so it's not so much that you have this, as that you have something again and again and again to communicate to residents and prospective residents. The National Apartment Association's Click and Lease program includes smoke-free housing language that you can add to your lease and gives you a spot to put in what your specific policies are. It's pretty simple and straightforward. We talked a little bit about enforcement here, but you really got to enforce your policy, and you need to be fair and consistent and organized. Follow your policy, and then look for violations during routine inspections and any interaction that you have. But one of the important things about smoke-free housing is they are largely self-enforcing, as residents prefer smoke-free living, and you just need to give them a way to report violations, and then you need to investigate those violations consistent with how you handle other lease policies, and then follow your policy relative to what you do about that. Again, we gave verbal warnings, written warnings, fines to the American Lung Association. Lease terminations and non-renewals and evictions were the last resort, but you do need to prepare to do those. If somebody will not follow your policy, you have to enforce your policy. And finally, damages to the property from smoking are not normal wear and tear. They can be very expensive, and they should be billed to the resident.
And it's
Carly,
always it's always a great idea to remind people periodically about your policy. Don't just assume because you have it that they will always comply. It's always a good idea. And this is just a great sample of a reminder that one organization put out.
Yeah, real quick, because we want to have some time for some questions here. A few lessons learned that we learned along the way. I can't say it enough. You've got to give your residents and prospective residents advance notice of this. You need to communicate again and again and again. You need to remind people. You need signs, educational materials, and make sure that nobody moves into your property or renews a lease without full knowledge of your policy. But then you need to enforce your policy. Smoking stations, I mentioned it, well-lit area, accessible, and add more if necessary, because that's where you're telling people they can smoke, and you want them to, if they want to smoke, go there and not violate your policy at all. Real key, smoke-free policies are about the smoke, not the smoker. Smoke-free policies do not preclude someone who smokes from living in your building. They simply require that all residents abide by the policy while they're on the property. And that policy applies to everybody, residents, guests, employees, and vendors. And as I said earlier on, sometimes it's those employees and vendors who are the ones who you have to deal with more than your residents. So you have to make sure that that is clear. Local apartment associations can provide some help. Carlene, you want to say a word, just a quick word about that?
Sure. In North Carolina, there are 2 smoke-free housing certifications, one through Greater Charlotte Apartment Association and one through the Triangle Apartment Association. And the Florida Apartment Association has an excellent smoke-free certification program. So if you're interested in doing this and you live in one of those states, you know, this is a great opportunity to be certified in smoke.
So welcome to your newest amenity, smoke-free housing. There is more help available. Here's a list of various states and their websites. Again, if you Google the subject, you will find a lot of information at your fingertips. And let's move on and see if we have any questions, James.
Well, thank you, Scott and Carlene and Anna. This is absolutely wonderful. And yes, audience, we're taking live questions at this point. We do have 1 or 2. Renata asked that reinforcing the smoke-free policy has been challenging for us. Any recommendations?
Well, the hotels, again, took the lead, and they are very aggressive these days. In fact, they're having to be careful to make sure they document their files and all, but it used to be that they threatened, in most cases, a $200 to $300 charge to your credit card or whatever your form of payment was and they rarely did it. Over the years, they've found that this is so important that they are very quick to charge if they have the evidence that smoking has occurred in your room. In our case, again, I think the real key is just like any other lease provision, you have to follow up, you have to pursue it. It is not always easy. Noise complaints aren't easy. Pet waste is not easy. This one, you just have to keep in mind that you potentially have tremendous liability if above and beyond just losing the other residents, but you also have the fire risk. So again, I told you what our policy has been. I'm all ears for anybody with a better policy. We have decided we need to be more aggressive on violations, but I don't have a magic bullet. You just have to pursue it.
Scott, another person asked, how much notice would you recommend to start a change in policy?
Well, how much notice are you giving on your renewals? I think that's the right amount of notice for your renewals, so that when you send somebody a notice of what their new lease rate options are, you include notice of what your new smoke-free housing policy will be. New leases, as soon as, right away. I mean, again, I don't think you want to have had somebody commit a month ago and show up today to move in and say, oh, by the way, now you have to commit to this new policy. But most people won't care. Most people will voluntarily commit because either they don't smoke or they don't smoke in their home for various reasons. So whatever your renewal notice policy is, that's probably the right amount of time.
Tracy had a question, Scott. If a resident smoked in the unit before we became smoke-free, can we charge them to repaint the unit?
Well, first of all, if all it took to get rid of smoke in what's now called third-hand smoke in an apartment was to paint it, boy, it would be a better world. But it takes a lot more than that. I mean, the smoke permeates everything. You saw the photo we had earlier of the brown walls. I've seen worse than that. And when we spent $12,000 on an apartment, we had to replace ductwork. I think we replaced cabinets and all the flooring. We had to seal the walls and the subfloors. And that's been 2 or 3 or 4 years ago. It would cost a lot more today. So, again, that's a bit of a legal question, but I don't know anywhere where smoke damage is normal wear and tear. So with suggestion that you talk to your own legal counsel, I've always viewed smoke damage as beyond normal wear and tear that should be billed to the former resident.
Okay. A couple of folks have asked to go back and see prior slides, and for them, what I'll recommend is when we post this to our YouTube channel next week, early next week, I would just simply go to the video, advance your cursor slide by quickly to where you need to go, and then just camp out on that slide and make whatever notes that you need. It might be a little bit too challenging right now to go back and look at separate slides. But another question. Would you need to implement this upon individual renewals or move-ins, or could you instead pick a start date for, say, 2 months out for everyone?
You can do anything you want to. The problem you have is, at least in my experience, the people who have declared it like a house rule, I know that that's the term used by, I think, the public housing world, but we have our own rules and regulations mentioned in our lease that we have the ability to change. Every time I've seen somebody try to do that, it did not work well. You're welcome to try whatever you want. Again, as Anna has said, you probably have the right to do it. The issue is whether you will be effective at doing it and getting the buy-in, and whether or not you can enforce that policy effectively when you made the change to people who already live there under existing leases that do not have any prohibitions against smoking. It's a legal question, but from a practical standpoint, we found that the slower phase-in worked much, much better than where we saw people try to do a house rules type of immediate impact.
Can I add something? Our recommendation is a minimum of 12 months to implement a policy. And with every policy needs lots of communication, signage, and quit support. So those are the three key components to success, I think, for a policy.
Yeah, I know when I first talked to HUD about this back in 2012. And, HUD doesn't move real fast, and they eventually issued what I think they called their final rules in very early 2017, after having giving a lot of notice to the public housing world that those rules were coming and that people would have 18 months after the publishing of the final rules for it would to be fully effective at 100%. I think they took their time, but I think they figured out that this slow phase in just worked better for everybody involved. It can be a little frustrating, but it's been successful for the most part. But again, you're free to try anything you want to, and please let us know how it goes.
Well, I'll tell you, Scott, we've reached our time here. Unfortunately, I have one or two questions we won't be able to get to, but perhaps we can advance the slides. And again, thank you to our audience for terrific questions, and thank you to our panelists for great answers. So next slide, please.
I can't, they won't move. Let me try again. There we go.
All right, terrific. Well, for all in attendance, for additional resources, NAA maintains an online portal for its many offerings in industry operations and compliance for the rental housing industry. And the URL is featured at the bottom of that slide. Next slide, please, Scott.
And James, I'll add that after the webinar, as you go forward, I'm sure the three of us, particularly, I'll speak only for myself. I'm available for questions and to talk to anybody who has open questions. You can reach out to James for my email and whatever contact information we need, and I'll try to help.
Excellent, Scott. Well, I'm sure that our audience appreciates that. And as I mentioned, this recording will be posted on our YouTube channel probably early next week. And all of the excellent slides and resources that Scott and his panel presented will be there for your viewing. So again, I wish to thank everybody here for participating. A special thanks to our presenters, Carlene, Anna, and Scott. And of course, a thank you as well to our audience. We value your membership and appreciate your attendance. Have a great afternoon.